Which of the following muscles is least likely to be involved in dysphagia or dysarthria? Options are pharyngeal constrictor, tensa veli palatini, stylopharyngeus or palatopharyngeus. Answer is option B, tensa veli palatini. A muscle of mastication responsible for opening the mouth has the following features. Which of the following statements about this muscle is incorrect? Options are: it aids in mandibular protrusion, it is attached to the medial surface of the ramus of the mandible, it is attached close to the temporomandibular joint, or it receives innervation from the mandibular nerve. Answer is option B, it is attached to the medial surface of the ramus of the mandible. Which of the following structures form the lateral wall of third ventricle? Options are corpus callosum, thalamus, cerebellum or pons. Answer is option B, thalamus. Which of the following gastrointestinal secretions contains of sodium? Options are duodenal secretions, ileal secretions, gastric secretions or saliva. Answer is option D, saliva. Which of the following neurotransmitters is correctly paired with its primary site of synthesis in the brain? Options are dopamine, locus coeruleus, serotonin, raphe nuclei, acetylcholine, substantia nigra, or norepinephrine, nucleus basalis of Maynard. Answer is option B, serotonin, raphe nuclei. Which of the following discoveries was awarded the Nobel Prize in Physiology or Medicine in 2025? Options are cancer chemotherapy, RNA polymerization, peripheral immune tolerance, or mRNA's role in post-translational modifications. Answer is option C, peripheral immune tolerance. Leptin resistance is primarily associated with dysfunction of which hypothalamic nucleus? Options are lateral hypothalamic nucleus, paraventricular nucleus, arcuate nucleus or ventromedial nucleus. Answer is option C, arcuate nucleus. During which phase of the cardiac cycle are all four heart valves closed? Options are rapid ventricular filling, isovolumetric contraction, ventricular ejection, or atrial systole. Answer is option B, isovolumetric contraction. During normal inspiration, systolic blood pressure usually shows a slight decrease. What is the primary reason for this physiological change? Options are increased left ventricular filling, increased systemic vascular resistance, decreased pulmonary compliance, or increased venous return to the right heart, causing a transient reduction in left ventricular filling. Answer is option D, increased venous return to the right heart, causing a transient reduction in left ventricular filling. Myasthenia gravis causes muscle weakness because options are the nerves don't send signals, muscles don't have enough acetylcholine receptors, muscles break down too fast or too much acetylcholine is released. Answer is option B. Muscles don't have enough acetylcholine receptors. A 45-year-old patient undergoes an oral glucose tolerance test. After fasting overnight, the patient's fasting plasma glucose is 95 mg per dl. 2 hours after drinking 75 g of glucose, the plasma glucose level is 165 mg per dl. According to the standard diagnostic criteria, what does this result indicate? Options are normal glucose tolerance, impaired fasting glucose, impaired glucose tolerance, or diabetes mellitus. Answer is option C, impaired glucose tolerance. Magnesium homeostasis in the body is primarily maintained by which of the following mechanisms? Options are bone resorption, dietary intake, urinary reabsorption, or intestinal absorption. Answer is option C, urinary reabsorption. Which of the following represents the most stable and long-term mechanism for maintaining homeostasis in humans? Options are oxygen saturation, urine output, heart rate, or respiratory rate. Answer is option B, urine output. Which of the following represents the correct order of steps in a standard polymerase chain reaction? Options are extension, denaturation, annealing, denaturation, annealing, extension, annealing, extension, denaturation, or denaturation, annealing, extension, hybridization. Answer is option B, denaturation, annealing, extension. In rheumatoid arthritis, the increased expression of TNF-alpha and interleukin-6 in synovial tissue is most likely caused by which epigenetic mechanism? Options are activation of histone deacetylation, inhibition of histone acetylation, activation of DNA methylation, or inhibition of DNA methylation. Answer is option D, inhibition of DNA methylation. Cancer cells exhibiting increased RNA transcript length compared to normal cells is most likely due to which mechanism? Options are gene silencing, polyadenylation, alternative RNA splicing, or gene amplification. Answer is option C, alternative RNA splicing. The M13 bacteriophage vector commonly used to identify specific gene sequences such as viral spike proteins represents which type of expression system? Options are yeast expression, mammalian expression, phage expression, or bacterial expression. Answer is option C, phage expression. During B cell maturation, the expression of a single immunoglobulin heavy chain allele to ensure antigen specificity occurs through which mechanism? Options are somatic hypermutation, alternate splicing of RNA transcripts, VDJ rearrangement, or alternate polyadenylation sites. Answer is option C, VDJ rearrangement. Tyrosine is a non-essential amino acid that plays a key role in which of the following processes? Options are synthesis of thyroid hormones, formation of collagen, urea cycle detoxification, or glycogen breakdown. Answer is option A, synthesis of thyroid hormones. Plasma magnesium levels are primarily regulated by which of the following mechanisms? Options are bone resorption, renal reabsorption, dietary intake, or gastrointestinal absorption. Answer is option B, renal reabsorption.